Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Good morning. We are still at Lyme Conference here, recording some information about Lyme Arthritis. It's been a good conference. Nice to meet with other doctors and hear research and PhD things. And we've been talking about a lot of the things we're going to talk about here today, which is what are the symptoms of Lyme disease, why does it slip through the cracks, and what are good solutions for it. And so I'm going to cover particularly some Lyme arthritis questions today because this is probably the most frequent presentation of Lyme. Is Lyme disease causes joint pain. It looks like an arthritis. It looks like rheumatoid arthritis. It looks like some kind of lupus or inflammatory arthritis. And so we end up at the doctor, and we usually end up at rheumatology. In the acute phase, once again, Lyme can cause, headaches, neck aches, and like joint swelling. So you can get right away when you catch it, like Lyme loves the knees. So you can get this big knee swelling or joint pain. But a lot of times it just looks like a flu in the acute. And then it's later stages that we get this kind of what looks like kind of an autoimmune inflammatory arthritis. And by late stage, we just mean anything over a couple months. And I have people in my office who have had these, chronic pains for years, sometimes even decades. But the acute usually lasts a month or two. And then after that, Lyme just looks like some kind of chronic inflammatory arthritis, typically coupled with some kind of fatigue and often coupled with other neurological symptoms, although not in every case. And once again, Lyme disease comes from generally ticks. It's not only deer ticks. It's prominently deer ticks, but it's not only deer ticks. I've seen plenty of research on that this weekend. And also it's Borrelia, but it's not just Borrelia burgdorferi. We have another article. I'm going through that. But, really, I've been looking this week at transatlantic speciation. And basically we've proven that the ones that were in Europe are now here, and the ones that were here are in Europe, and the ones that were in Asia are now here, and the ones these things travel all over because people travel all over, and animals travel over, and birds travel, and it's just there's too much travel. So at this point in time, if you're not running multiple species of Borrelia, you are doing it wrong. I think we run 18 species of Borrelia right now in our current thing. You can't run just Borrelia burgdorferi. It's one of the hugest mistakes in our common medical system right now. Let's talk a little more about joint pain. So this can happen both in the early stage where you get a local tissue swelling, but I see it most often in what's called the disseminated or late stage Lyme disease, which is really anything lasting more than a few months. Pain happens in about 50 to 60% of cases. So we can get various kinds of pain. We can get joint pain, we can get muscle pain, you can get joint swelling, and you can get headaches and neck aches. These are the big things. But the hallmark, the most famous part about Lyme arthritis is that it tends to come and go. So it tends to move around. And so this is really the problem we run into is that you go to the doctor for your shoulder, and then it pops up in your elbow, and then it pops up in your knee, and then it pops up in your ankle. And at the beginning, it can be very hard to find. Lyme is one of the only things that does this migrating joint pain. Now, once again, this is one of those where if we find it right away and you have a bullseye rash and it's very obvious it's Lyme, the antibiotics, 2 to 4 weeks of antibiotics really do well, 80 to 90% success rate in the opening month. And, after 2 to 3 months, really the success rate for that protocol is poor. Extremely, extremely poor. An 80, 90% success rate means you're still going to have some people who get the antibiotics right away and don't get better. I find medicine doesn't know what to do with you. I had a patient last week who they just declared cured. So they got Lyme, got confirmed Lyme, took the antibiotics, and then went to the doctor and said, it didn't work, which once again, we know happens 10 to 20% of the time. And the doctor said, no, you took the antibiotics, you're cured. and the patient told me, like, I don't feel cured. I still have a lot of pain I didn't have before this all happened. And, I think that's just a case of not listening to patients, really. And I think it's funny telling someone they're cured when they're not better. That's a dangerous thing as doctors. We want to just highlight this pain and swelling can come in a variety of joints. But once again, I mentioned it loves the knee and it tends to move around. That's really the key differentiator with Lyme. It can be the neck, It loves sites of old injuries. If you have an old back injury, this can get confusing because you go, oh, maybe it's just my old injury. But it tends to take old injuries, likes to go there, and then exacerbates that. So instead of being a 2 or 3 that kind of nags you on and off, now it's a 7 or 8, and it's really interfering with your life. So hallmark is migrating joint pain. What does this Lyme disease joint pain feel like? Guys, it just feels like inflammation, to most people. And, that's hard because there's many things that can cause this inflammation. But ticks start to get up there as you have more doctors who aren't quite able to pin this down, especially, as I said, if you live in a tick endemic area, which is anywhere there's deer. So how do we diagnose? I really recommend that you just run a very thorough Lyme and co-infection panel. Remember, 93% of people who have long-term symptoms have co-infections, and running only Borrelia burgdorferi is wrong. I think we run 18 species of Borrelia. Any Borrelia will simplify by just saying it's Lyme. You need an immunoblot, not a Western blot. Okay, and we have a whole article on this. You should go check it out. Some people with these kind of problems will get imaging like MRIs or X-rays, and this can be very useful for showing that there is damage. The problem we run into is it doesn't really show why there's damage. And as a doctor, we always want to know why, because if I know the why, we're going to get better long-term results than if we don't. The other thing is, what do you do for treatment options? We've mentioned this, but, the antibiotic protocols have an 80 to 90% success rate, 2 to 4 weeks of antibiotics. For Lyme arthritis, it's supposed to be 4 weeks. For the rash, it's supposed to be 2 weeks. So you are supposed to get a little longer course if you have Lyme arthritis. But I want to highlight that this really only works when you catch it right away. So if you got bit 2 weeks ago, you're coming in and this is where it's coming from, doxycycline and the alternative cefuroximine is typically very successful. Once again, 80 to 90% success rates from best we can tell. But guys, if you're catching this 3 months late, it's probably not going to work. There's a study last year where I think it's Tulane took mice, waited 60 days to give them the antibiotic protocol, and this protocol fails once it's 60 days old. So by that time, the Lyme's getting chronic, it's moving into biofilms, it's moving into stationary phase, and it's not going to be treated so easily. So what do you do if it's chronic or post-treatment Lyme? Well, that's really what our whole clinic's about. Almost all my people I work with have been sick for months or years, and getting rid of chronic Lyme can be more difficult. I've done work with heavy antibiotic protocols. What you do is you'll find doctors who certainly do lots of antibiotics for a long time. They'll do IV, they'll do oral. They'll do 3 antibiotics for 6 months, 12 months, 18 months. I would just tell you in my experience that that is a very hard protocol on your body. It's very hard on you to take that much antibiotics for that length of time. And we've had better success using a very scientific, natural approach. I really like the science behind some of the herbs. You still need to test and measure and customize a program for each person. But the basic approach that we take is we want to do 3 big things to heal from chronic Lyme. We want to, 1, help attack the bugs, the Lyme and the co-infections that are in the forms. So you need things that kill the bug when it's in the chronic forms, behind the biofilms, inside the cells, in the round bodies or the stationary forms that are much more resistant to regular antibiotics. You want to help the immune system. I cannot stress, this is the most important thing I think you actually have to do, is you have to help the immune system, which right now is fighting the bug and losing. That's a huge point. And then lastly, you need to help repair the parts of your body that are broken. And if you're doing those 3 things, you're going to be much more successful in helping your body heal from chronic Lyme. You can get better. This Lyme arthritis can go away. You can have joints that work and range of motion, and you can go hiking, you can go kayaking, go fishing, do all these things, whatever it is, you want to do. We always tell people we want you to be healthy enough to do whatever it is God has for you to do. So I'm Dr. Warren. I hope you find that helpful about Lyme arthritis.